If you've got tendonitis, then you need to know about this option to be able to create a healing response in the area so that your body can actually get rid of the chronic inflammation and you can start to get better. My name's Luke. If this is your first time here, welcome. I'm the lead practitioner at Body Zest Banstead. We treat a lot of people for all sorts of things, neck pain, back pain, but we do sports injuries and we do tendinopathy. And we've got a really cool treatment for tendinopathy, which not a lot of places have, that works really, really well. So this is called Shockwave therapy. And the way that it works is that it's essentially creating some micro trauma in an area that your body is struggling to heal. If you've got a tendonitis problem, then essentially you've got something called chronic inflammation, where the body is just not clearing out the inflammation in the way that it should, so it's beginning to linger. And the whole principle around shockwave therapy is that we're creating a brand new bit of trauma, and it's only micro trauma, but it is trauma, to create a brand new healing response so that then the healing response can bring in new inflammation and clear out inflammation, and then it will actually clear out that chronic inflammation as well. So it's kind of like taking the injury back in time, maybe 6 months to the beginning for the sake of your body's self-healing mechanisms, so that instead of where it's got to, which is a place that it can't heal, we take it back to the start to when it actually can, and then that can resolve it. There's different approaches that you can take with shockwave therapy. Essentially the one that we do, it's going to be bespoke and tailored to the person, but if I have to generalize, the approach that we're going to take is, let's use a tennis elbow for example. We're going to shockwave the actual tendon itself to create that healing response. Then we're going to be thinking, well, why did this happen? So we're going to do some hands-on treatment, probably onto the wrist extensors because they're likely to be tight, and maybe down the triceps and the biceps. Potentially if this problem has come from the shoulder, there's going to be tension here too. That's going to be a minimum course of 6 appointments, okay, because it does take a little bit of time for shockwave to start to work. But if we combine all of this treatment, get you to have some self-management strategies as well, and start to loosen the muscles and create the healing response in the tendon, then we can give you the exercises to begin to build strength in the area after that. And if we do it in that order, create the healing response, reduce the tension and build the strength, it is a really, really good way to get very consistent outcomes with our patients, as long as they adhere to the other little bits we need, like stop flaring it up, reduce the activity which flares it up essentially, just for a short amount of time whilst we go through this process. And we can apply this to basically any tendinopathy. There'll be slight differences in the way that we approach actual administration of the treatment, but for the most part it's all pretty similar. Treatment should normally take like 25 minutes, something like that, but we'll spend as much time as we need to make sure that you get everything you need to be able to create that healing response. So I hope that helps, guys. If you've got someone who isn't us near you, then at least you've got a little bit of education around how this works, and you should be able to ask the right questions and make sure they know what they're doing. If you're in our kind of area, South London, Surrey, UK, and you think you've got a tendonitis, you've got a tennis elbow or just something like that going on, we offer everyone a completely free discovery visit at our clinic, so you can come in, talk to one of the practitioners, and essentially see if it's something that we think we can help with. We can explain to you how shockwave works face to face. We can answer any questions that you might have. If you want to do that, there's a link to our website and you can always book it nice and easily on that. If you're not in our catchment, you're seeing someone else, then good luck. Hope this helps.